Welcome back to Empowerment Nursing. I'm Linda and this is Ashley and we are nurse educators. You are tuning into our series In the Know where we make it simple. Today we are sharing with you what your nursing regulatory body needs you to know.
Before we get started with our list of must-knows, we invite you to subscribe to our live videos so you'll be notified whenever we go online. You can also subscribe to us on YouTube where you can find a whole bunch of content-related videos. Like and share this video with your nursing friends and be sure to follow our Facebook page and check out our website at www.N-Powerment where you can view all of our complete study packages for your registration exam. So now we are going to talk about 5 points to consider in relation to what your nursing regulatory body needs you to know. What do we mean by nursing regulatory body? Depending on what state or province you live in, or even country, it's the College of Nurses that you have to register with in order to receive your nursing license. So what do they want you to be aware of as you step into this process? Point number 1. This is a very important point. If you live in a location, this varies state by state, province by province, and depending on if you're writing the CPNRE, NCLEX-PN, or NCLEX exam, if you live in a location where you have a limited number of attempts to pass, at which point if you do not succeed, you no longer have any attempts at the exam, at which point, depending on where you live, you may have to repeat your entire program of study, or you will have a certificate or a bachelor's degree without the license to practice nursing. If this happens to be your situation where you have a limited amount of rights, the regulatory body wants you to recognize that you should take every single attempt very seriously. What we often see is a series of events retrospectively. So individuals will come to us after they have tried multiple times, perhaps even they have one more attempt left. We see this often. And kind of what we surmise in our conversation often is that the first attempt is kind of like a meh, I'm going to go kind of give it a shot, feel it out, see what it's like. Not necessarily study, trying to avoid that whole stressful study process, because maybe I'll get lucky the first time. What happens though, after you lose that first attempt, then on the second attempt, you have all of that added stress, right? The second attempt, typically speaking, nothing's done differently. You prepared the same way you did for the first attempt. And then if you get to the third and often final attempt, you have all of that kind of anxiety around, this is it, right? I either succeed this time, this is my last chance. So you can see how not taking every opportunity or every attempt seriously can lead into a cascade of just repeating the same.
Point number 2, we've met a lot of graduates who come to us after they've attempted to pass, and sometimes they don't realize the purpose behind their regulatory body, depending on the province or state or country in which they live. The regulatory body or the college who is providing this license to you, they are primarily interested in one outcome. And that outcome is the public safe from you? That is their main prerogative, to make sure whoever is out there with the license isn't going to hurt the public, right? And so this is very important. You can't assume, this regulatory body can't assume that just because you graduated means that you're safe.
Right.
So this is very important.
And to build on that point number 3, if the mandate of the regulatory body is public safety, how do they assess whether or not you are safe for the public? Basically, there's 2 ways they do that. The first way is that you have to graduate from an accredited establishment, meaning that they are recognized as an accredited school and you're eligible to write the registration exam. So there's that. You have to graduate from an accredited place. And second, you have to pass the registration exam. There's no other way for them to say you are safe to practice. So regardless of all of the rest of the things, you have to meet those 2 requirements.
And point number 4, there are graduates who excel in clinical, are very good with hands-on bedside skills, and excel very well and have excellent clinical evaluations. But they may have always struggled to do really well on midterms and finals and all of the tests that are involved. So the regulatory body wants you to know that even though this may be true, and you were wonderful in your clinical placements, you still need to pass the registration exam. You can't validate your safeness to be out there in the public by just telling them, oh, I was really good in clinical.
Right.
They need you to demonstrate that by passing their exam.
Exactly. And point number 5, and perhaps the most important point number 5, and we have this conversation with thousands of individuals that we speak with. The registration exam would want you to know that should an event occur in your life and you are too upset to focus on the rite that you have scheduled, they would want you to reschedule that rite for a different period of time. This is because often once you exhaust your attempts, if you want to appeal for another attempt and you want to validate why you didn't pass based on some situational stressor, perhaps it's a big stressor, right? The registration exam is not responsible for you extending your rite or when you write it, you know? So if you experience loss, grief, frustration, stress, a major life transition, any of those things, postpone your exam. Don't write it under duress. Don't write it under stress. Don't write it under any circumstance that might hinder your success on that exam, because the registration regulatory body's response to that would be that you should have postponed you writing that exam as opposed to used an attempt when you weren't in the right frame of mind to write the exam.
Correct. So let's recap these 5 points. The first point is take each right extremely seriously. The second point is that the regulatory body's primary interest is that the public is safe from you. The third point is that the accreditation that you must graduate from an accredited school, and you must pass the registration exam. These are 2 measures that you are safe to practice. The fourth point is that they want you to know that even if you're great in clinical with hands-on skills, you still need to pass the registration exam. And the last point is, if there is anything that comes up for you and you cannot write, reschedule it. Don't waste an attempt during a moment when you can't focus. If you're looking to gain all the confidence, content, and critical thinking and fun to pass your NCLEX or CPNR exam, we have complete NCLEX, NCLEX-PN, and CPNRE course packages. We guarantee you will pass or your money back. Thank you for joining us. We'll see you next time on In the Know. Bye for now.